He may well look glum. This is a bad time for China. 26 deaths so far from the novel coronavirus and at least 830 infected. And an unprecedented quarantine. Wuhan and central China and nearby cities in lockdown, not a soul to be seen. Except here, like an art installation, the Dance of the Diggers, purportedly a building site for a hospital, the authorities say will be ready in 6 days. The new strain, not previously identified in humans, is causing alarm, though the World Health Organization says it's too early to declare an international public health emergency.
At the beginning of any outbreak, you would focus more on the severe cases, and you will have more of those, and then maybe we are missing some mild cases because people will just be a little bit sick.
Today, the Lancet Medical Journal published preliminary data from Wuhan, saying the virus appears to cause similar symptoms to SARS, also a coronavirus, which killed 800 and infected 8,000 in 2002-03. The similar symptoms are fever, dry cough and shortness of breath, but not, and this is what makes it different, a runny nose, sneezing, sore throat or diarrhea. The source of the initial infection of this coronavirus is still not known, but the working theory is that it's from animals sold in the Wuhan fish market. The virus has then transferred to humans and then between people, breathed in and damaging the respiratory system with no treatment. The most important health message is wash your hands.
I've studied the early stages of a lot of pandemics in history, the classic one being the 1918 Spanish flu. And sometimes they do begin with mild illnesses or not very serious illnesses. But that can all change if the virus suddenly mutates and finds a way to transmit more efficiently. So that's the big unknown.
A second Lancet paper reports on a family of 7, 6 of whom tested positive. None had visited the market, but one had been to visit a young child in Wuhan hospital. The authors say the vigilant control measures are warranted at this early stage, but they also say this is a snapshot of one family, and they still don't know how efficiently the virus spreads. Cases have now been confirmed in Japan, South Korea, Singapore, Thailand, the US and Vietnam. But 14 suspected infections in the UK have all been negative, although officials are now trying to trace as many as 2,000 visitors who have arrived here from Wuhan. Today, the Cobra Emergency Committee met for an update, and while the risk here remains low, a public health hub is being set up at Heathrow.
I think we should definitely see this as a marathon, not a sprint, and we need to have our entire response based on that principle.
Back in China, this is the morning after a party that never happened. In the Forbidden City in Beijing, they've taken down the lanterns to celebrate the Lunar New Year. This is a country battling against a new virus.
Well, Kathy has been speaking to Richard Hatchett, the CEO of the Coalition for Epidemic Preparedness Innovations in Davos, and she asked him to explain more about this virus and its characteristics.
Well, I'm quite concerned. I think most global public health leaders are very concerned. We've watched this virus emerge. The epidemic has grown rapidly. It's spread internationally rapidly. We've seen a number of deaths. The virus belongs to a class of virus called coronaviruses, and we have prior experience with coronaviruses with SARS about 15 years ago, and more recently with a disease called MERS, Middle Eastern Respiratory Syndrome. Both of those viruses have high rates of mortality. SARS was about 10%. We don't know what the mortality rate for this virus is, but we know it can cause very severe illness and death.
How likely is it that the virus may mutate to become more dangerous or less dangerous?
I have, in 20 years of working on epidemic preparedness, I can't say that I've been more concerned than I am about the current virus. This is a virus that has a wide spectrum of illness, from very mild to very severe or even fatal. And the problem is that people who have very mild illness in the middle of flu season, flu and cold season, may not even realize that they have this virus. And they may continue to move around, they may continue to interact with people and actually spread the infection to other people who may be more vulnerable to severe illness or death.
Have authorities around the world acted aggressively enough, in your view? Because flights were coming into Britain, for example, from the Wuhan area as recently as Wednesday, I think. Should authorities around the world have acted more aggressively?
I think authorities around the world are taking this outbreak extremely seriously. The problem with travel restrictions in particular, when you have a virus that has an incubation period of several days or a week, people will be traveling before they get sick. So it will be impossible to keep the virus out even by doing intensive screening at borders. And travel restrictions aren't really going to slow the global spread of the virus. And so doing things that impose huge social costs in what's going to be a futile effort to stop the spread of the virus, it's just a disproportionate response.
I know the details are still sketchy, but where is it most likely that this virus will have come from originally?
What we do know about this outbreak is that it does seem to have been associated with transmission, early transmission in a wet market in China where live animals were sold. And it's undoubted that the virus jumped from some live animal species into humans.
Just tell us about the kind of vaccines that are being developed and how different they are from vaccines for other illnesses. What's the sort of new technology being used?
The first set of investments, we actually have 3 different kinds of vaccines. 2 of them are what we call nucleic acid-based vaccines. So one is based on messenger RNA, or mRNA. The second is a DNA-based vaccine. And the third vaccine is basically contains a protein from the virus, and it exposes that protein in a way that the immune system can see it and respond to it very effectively. I think the other important thing, what we can use right now are what are called non-pharmaceutical interventions. And they can also be things that the Chinese are now using, which include, preventing mass gatherings, potentially closing schools, potentially even introducing travel restrictions. I'm very concerned. That's all I can say. I think it's moving very rapidly. I think it's going to be a real challenge to contain it. In one sense, if there is a silver lining, it is that the outbreak first occurred in China, which can do extraordinary things as a country and introduce really extraordinary interventions, and they are responding very aggressively and very responsibly at this point.
Richard Hatchett, thank you very much.
Thank you, Kathy. It's a pleasure.
Well, joining me now from Nottinghamshire is Professor Steve Sang, who's the director of the China Institute at the London University School of Oriental and African Studies. Locking down cities that are home to tens of millions of people sounds extraordinarily difficult. I mean, how easy will China find it to enforce this?
Well, they will be able to enforce the main transport links like rail link or air link, but they are not in fact closing all the roads. And therefore, people are still able to travel. It's the poor who require public transport who cannot travel. The better off are still able to travel and get out of Wuhan and spread the disease if there happens to be carriers.
What do you think the impact of this will be on those cities? Not least sort of economically. I mean, people have been looking back to the economic cost of SARS and saying it was extraordinarily high. Shutting down millions of people's homes and businesses will have a considerable impact.
It will have a considerable impact. We are looking at the start of the Chinese New Year holiday season. So in the short term, most families in China will have very well-stocked refrigerators, so they will have food for the next week or so. But if the links are not being reopened, at the end of the festive season, Wuhan will run out of food and other essential supplies. Restaurants will not have food to serve their customers. And a lot of other problems will come with the cut-off of the communication links. I suspect that they may well have to rethink that when that point is being reached.
Do you think people will remain compliant, or will they resist?
Well, at the moment, people in China are much more focused on the Chinese New Year festivals. Is the people, again, we're talking about tens of millions potentially, who in effect have the Chinese New Year holiday being cancelled. It's a bit like cancelling Christmas for people in this country. And they are likely to be very disappointed with what is happening and disgruntled. But the way to challenge the authority in China is very, very difficult. So I think they have, at the moment, not a lot of choices.
Now, quite a lot has been made about how much China has been sharing scientifically in terms of information and how it compares to the past. Can the international community trust that China is sharing everything?
Well, the Chinese government is handling this with a much more open approach than they did with the SARS crisis in 2002 to 2003. On the previous occasions, they basically covered it up until they could not do so. This time, they are not covering up. But the problem with the Chinese government is that they are never terribly forthcoming when it comes down to collaboration with other countries. So a bit more forthcoming cooperation will always be helpful to both sides.